Now, in this section, we are going to discuss the medico-legal aspects to the thermal injuries. Now, when we get a case of thermal injury for the medico-legal examination, or we get a case of any death which was apparently caused due to burns, we have to basically differentiate it whether it was ante-mortem in nature or whether it was post-mortem in nature. Because usually the criminals mislead the forensic experts by putting on some things that will lead you to a burnt case, but actually the death was caused due to something else. So that is what we'll be briefing that in this section. We'll be discussing the ante-mortem and the post-mortem nature of the burns, and we'll be discussing the age of the burn. The age of the burn is basically the changes that occurs in the burn injuries with the passage of time, and how basically the healing process occurs and what are the end results. They're really important. As I've already discussed that the burn injury, the healing process and the scarring depends upon the extent of the burning. So we have to keep that in mind as well. Now, coming on to the ante-mortem burns. Now, the ante-mortem burns have particular characteristics which are not found in the post-mortem nature of burns. So, if we find all of these characteristics in a burnt case, that indicates towards the ante-mortem nature of burning in that type of death. The first and the foremost point is hyperemia. What is hyperemia? Hyperemia is basically increased blood circulation to any body part. It is referred to as hyperemia. So as I've already shown in some pictures, the post-mortem lividity in cases of burns is cherry red discoloration. Now this cherry red discoloration is very significant in cases of burn, because it basically shows the presence of carbon monoxide, the presence of carbon dioxide while the person was dying. So the post-mortem lividity is of hyperemic type. Now coming on to the second point, that is the vesicular formation, the blister formation. Now all of these indicate towards the inflammatory processes that are occurring in a body. Now the vital processes, the inflammatory processes are a part of a living person. So when these vesicles, these blisters are formed, they are indicating towards that the person was alive while while he was burning and while the flame was there. Now, the third point is the presence of the carbon or the soot, the presence of the soot. Now, the presence of the soot in all of the respiratory tract, we have to look for it. We have to look for it in the lungs. We have to look for it in the nasal cavities, in the respiratory, all of the respiratory tract, in the trachea, during the post-mortem. This is very important. All of this carbon, the presence of carbon, this presence of the soot indicates towards the ante-mortem nature of burning. The presence of carbon monoxide in blood. Now, there are specific tests that we have to carry out after the samples have been sent to the chemical examiner, and the presence of carbon dioxide in the blood points towards the ante-mortem nature of burning death. Now, what is basically happening in this picture on the right is there is a sign of a firearm injury, a gunshot wound is present. And if some signs of other cause of death are present, we have to investigate that. We have to find that on the body. We just don't have to go what we see. We have to investigate the death. What was the final cause of death? So if we find any other sign, then it is indicating towards the post-mortem nature of burns. Now, coming on to the age of a burn. Why is the age of the burn important? The age of the burn is important because it indicates the steps of the healing process after a person gets burned. So what basically happens here is immediately the reaction is the redness of the skin. Any type of burn, it can be a flame burn, it can be a wet burn, a chemical burn. Immediate reaction is the redness of the skin, which is followed in 2 to 3 hours by the vesication. Vesication, as I've already told you, it is basically an inflammatory process. The vesicles are filled with proteins, with albumin, and it is basically indicative of the living process, and it is after 2 to 3 hours. Subsequently, after 36 to 72 hours, it is followed by a purulent inflammatory reaction. The vesicles are purulent and they become filled, they become coagulated. After that, 1 to 2 weeks, the slowing of the injury starts occurring. That basically indicates towards the healing process. After 2 weeks, the granulation tissue formation is there, and the end result is the scar formation. The scar formation eventually depends upon the category of the burn, whether it was a first degree burn, whether it was a second degree burn, or whether it was a third degree burn. So this age of burning is important in a living case. When we get a case in an OPD, when we are investigating a medico-legal aspect to any case in which there was the throwing of the acid, for example, in vitriolage, if there was throwing of an acid, as shown in the picture on the right, the victim was maliciously intended by throwing an acid on her face. And all of these processes, that is the vesication, the purulent formation, and finally the scar formation, will eventually lead to the how will we basically investigate the case and how will we get to the criminal. So in this section, we defined what are the medico-legal aspects to the burns, how are we going to determine whether it was an ante-mortem burn or whether it was a post-mortem burn, the age of the burning in cases of vitriolage, which is very common in our country. So we have to really focus on that. Thank you for watching sqadia.com.